It was a Saturday evening, having takeaway at home with my partner and my sister and brother-in-law. And then I fell asleep on the sofa and I woke up with a really strong feeling of indigestion. Didn't link it to my heart at all, even though we have a really strong history of heart problems in my family, and just felt like I had indigestion. So I decided to try and find some Rennies in the cupboard and couldn't find any, so admitted defeat and just toddled myself up to bed. And within about 10 minutes of being in bed, I just turned really violently ill. I was sweating like I've never sweated before, by the bucket load. I was lying pretty much naked on the bathroom floor, trying to cool down on the cold tiles. I was vomiting, really strongly. I just felt really nauseous, really dizzy, and just really weak. So we called 999, but we couldn't get an ambulance, unfortunately. So because of the demands at the time, and was just informed that if I was to stop breathing or become unconscious, that I should give them a call back. But we decided that we wasn't going to wait for that, so we got a taxi over to my local A&E, which was over at Aintree. Once I was in the waiting room, after about 5 minutes, I went into cardiac arrest, and I was quite severely poorly in Aintree A&E. They did CPR and I had, I believe, 10 shocks to try and bring me back around and try and get my heart back into rhythm. It was caused by a blockage of my LAD, which we didn't know about that at the time, obviously. But I was blue lighted over to Liverpool Heart and Chest from Aintree. Yeah, so obviously I was intubated at this point, so they didn't explain it to me because it was an emergency procedure, so it was done whilst I was unconscious. But there was a little tube put into my right wrist, and it was basically a little wire that goes right through my arteries and my veins right up to my heart, and that was what was able to discover the blockage in the heart. So whilst they were in there, they were also, whilst the wire was in there, they also were able to inflate like a little balloon type device inside of my blocked artery to try and release it a little bit. And then it had like a mesh tube inserted, which now enforces the artery and keeps it open and lets the blood flow. So this was all explained to my family, while they were here in the relatives' room, waiting for me to come around. But it was also explained to me, in great detail when I came round. By Sunday evening, I was brought out of sedation and was able to be moved over to critical care. So I was in intensive care for less than 24 hours, and then moved to critical. I stayed in critical care for probably about 5 days after that, where I had a lot of interaction with lots of different medical teams and medical staff. So because I felt supported, and I felt like I was getting all of the different support, especially for the traumatic side and the emotional side of things as well. Because we all really, when someone's had a heart attack, a lot of people will look at the physical side of things, but not so much on the emotional side, and I think that was really important to me. I've been so complimentary of it ever since I've left hospital, and whilst I was here as well. Everybody has been absolutely phenomenal from start to finish. From that first nurse that I see in intensive care when I opened my eyes, not knowing where I was, what I'd been through. They were really softly spoken, really informative to me about what had happened. Really just really empathetic, which was really good. It wasn't what I felt like it was all focused purely on me. It wasn't just a script or a one cap fits all. Everything was tailored and individual to my needs. I met with clinical trial staff and agreed to join a clinical trial, and they've been in touch with me constantly since. And I just feel like everything from start to finish, from cleaners, caterers, doctors, nurses, everyone was just exemplary. So I've changed a lot since I was here. I mean, I wasn't a majorly unhealthy person before a heart attack and cardiac arrest, but I wasn't the healthiest either. I was a little bit lazy with exercise, so I would take the dog for a walk, but that would pretty much be it in terms of exercising. I did smoke, and I've not smoked since, and I've obviously changed my diet as well. At 40 years old to to be coming into hospital with such a serious condition that I had. I never expected to have been in that position, but then to be 2 months later living a normal life again, it's just incredible. What the medics here can do. So.